Hey everybody, Wally and Mike here from the Mod Institute, and we really want to spend some time with you to kind of review the anterior deprogrammer, nociceptive trigeminal inhibition (NTI) device, and kind of COIS style deprogrammers, and talk about some confusion out there on how to design these and the little eccentricities and do they actually even matter, and more importantly, what are they used for, and how do you actually use these, or how do we use these, not necessarily pulling from anything else but our own experience with these types of devices.
Yeah, and so there's lots of different names that are used for an anterior contact point split, an anterior deprogrammer, an anterior biplane, a Lucia jig, a quick splint. There's all kinds of different names, but they all really function the same, and it's to separate the back teeth to lower the muscle activity of the elevator muscles of mastication, which can allow for a more reproducible centric relation or a terminal hinge access bite record. I really love this type of splint. We use it specifically when we're trying to take a CR record with the mod jaw. It works really well for that, whereas the Lucia jig style or some of the other anterior bite planes that cover the incisal edge of 8 and 9, they open the bite too much for the mod jaw to record the terminal hinge access reproducibly, and so it works really well for that. And
What are the risks of, I've seen some people open people tremendously with the anterior contact point device. What are we concerned with there?
Yeah, so these type of devices you never really want to use long term. You will run the risk of having posterior supereruption, which can result in an anterior open bite. Obviously we don't have great predictors on that. Is it always going to happen? Is it 20% of the time going to happen? There's no real literature that dictates that, but you don't really want to run the risk of any type of deleterious effects for what you're trying to do, which is helpful treatment for your patient or to get an appropriate record to provide some treatment. There was a study in 2020 by Lee where they looked at some extraction sites to see how quickly supereruption could begin to occur, and within the first month they're seeing 140 to 150 microns of supereruption on average, which is certainly clinically significant and will affect any treatment that you would be prescribing later on.
For sure. Now, my specific design that I did was, based off of a ton of evidence in the literature that we have around these types of COIS style deprogrammers, and I pulled specifically from Marta Rivera-Leone, who did a recent study in 2022 and showed actually how to design these in exocad. In that publication, really well done publication. I love when people actually share information and help each other out, and one of my favorite things to do is pull from the literature to be able to better understand these things. My particular design had a flat plane, roughly around 3mm platform, that was very similar to COIS style. I have not taken any COIS courses, but I have nothing but respect for John COIS and what he's doing to help better dentistry. But with that said, I feel like there was some confusion around this and exactly how to design it and what exactly this does. So we really want to try to clarify some of that and really take some time to dive into these types of devices and exactly, not only at the end we'll talk about how do you literally design these in exocad, but we also want to just clarify some things around this appliance because we've had some comments about, why would you ever use something like this? This seems really like a bad idea to open somebody up. They're worried about teeth moving and super eruption. We don't use it as a long-term device.
No, never. And so, there was a study in 2008, it was reviewed by Stapleman, where they looked at the risk of, any of these anterior bite planes. One of the super popular ones for a while was the NTI. The nociceptive trigeminal inhibition splint, which people were using for headaches, and they do see a significant risk for posterior supereruption when you're using that type of device longer term. So we use these really for getting repeatable hinge access records for treatment that we're going to be prescribing to patients. You need, anytime you're doing, a reorganization of someone's occlusion, you need a repeatable hinge or some type of record that you can restore to when you know that the teeth aren't necessarily giving you that because they're too damaged or the bites collapse and you need to open the vertical. There's lots of different reasons why you would do that.
So why take the time to make one of these and not just pop cotton rolls in there, or Lucia jig, or maybe like even a leaf gauge? What does taking the time to do something like this mean? And have you ever sent somebody home with this for a day and get them back the next day?
Yeah, I've certainly used this on those shorter term time frames. You can have people who have really disorganized musculature where their bites are completely all over the place. They have no reproducible excursive movements or hinge that you can record and feel comfortable about. This is one of the ways where you can send them home for a couple days. It's larger, obviously, than a Lucia jig, so you don't really run the risk of aspiration.
Yeah.
And so it's comfortable for most patients. And I really like to do these where we're just open just past the first point of contact.
Yeah.
I know in Marta's publication, they said it's a 1 to 1.5 millimeter to open in the posterior is kind of what Koi style does.
Yep.
And so we don't necessarily follow that. So because we use it, I think, for slightly different reasons. I also have never taken any Koi courses and don't purport to be an expert on his philosophy.
Sure.
But also really respect him driving a lot of our decision process into being more literature and evidence-based. But there are many other ways, and other devices that you can use to do the same thing that we use this for. The College of Prosthodontists Best Evidence Statement in 2021 showed that there's any number of things that you can use to record a repeatable hinge access. You can use a leaf gauge, you can use an anterior bite plane, you can use bimanual manipulation. There's a number of different things. I like things the simpler that I have to, I can really let the patient's musculature and anatomy help me, then I want to do that, and that's really what I find this useful for.
Yeah, I mean, you did this last week on that full mouth reconstruction where we did a jaw tracing and they could not have any repeatable tracings at all. And that's when you know that something's going on, you need to deprogram them. Sent the patient home, got them back, I think it was the next day, and retraced them, and it was amazing. The traces on the jaw were beautiful. It was like this patient forgot all the things that were inhibiting normal movement. And that's what this is really what we use this for, is to augment jaw tracings and things like that. Now, with that said, these are one of the easiest things in the world to design. So I'm going to give you guys a tutorial on exactly how to design this. So stay tuned for that. And you can follow along with me. I'm going to have a little thing for you to download as well if you want to play along. So thanks for your time, guys. Stay tuned for that design coming up right here. Let's dive into the design of one of these appliances. It's perhaps one of the easiest things to design, and there's no need to be overcomplicated. So let's call it a bite splint, and my minimum thickness is 0.3 and my desired thickness is 1.5 millimeters. And what we're going to do is we're going to jump into this design. Now, this patient was scanned using a leaf gauge to ensure that there was no interferences during scan and that she was scanned at an open bite. And what I'm going to do, I'm going to load the files for you guys so we could see here. And there we are. And as you can see, they come in at an open bite. It's important. I don't think that you should be scanning an MIP with these, but it's possible. You could open the pin virtually on the articulator or just make a huge heavy contact, but it's unpredictable. Now, when setting the orientation of the appliance, split the difference buccal lingual, and you want equal undercuts visible on the lingual surfaces of the maxillary teeth. And so you're kind of looking straight down at that path of insertion. Now, this particular patient has very few undercuts on the lingual surfaces, so I'm going to go ahead and engage 150 micrometers of undercut on those surfaces to allow a little bit more mechanical retention. And depending on your printer, you could go all the way up to 200 microns of engagement. And again, very printer specific to those settings on the desired tightness of the fit and also the surface area undercuts that each individual patient presents with. Now, my desired minimum thickness is about 1.5 millimeters. And I'm going to go ahead now and draw my margins. Now, this is where you could get very and oddly particular about where the margins belong, whether they go down more in the palate and the anterior and up more in the posterior towards the necks of the teeth, the CEJ areas. And honestly, the main thing is that you ensure adequate distribution and tissue contact to avoid movement of the appliance. Now, this is important, this lingual margin line, it depends on the patient specifically, and you don't want to draw that into a blockout material because then it will be blatantly open. Anteriorly, I like to create a little bridge across, up at the contact point between 8 and 9. And then again, posteriorly, not quite all the way at the incisal or occlusal surface there to avoid any type of interferences where it sometimes will tend to wrap over. Now, one important thing was to make sure that design on pallet was checked back there at that previous step. And that is a critical thing, or else it won't let you design like that on the pallet. Now, smoothing this, I usually just go to smooth flatten and I hold shift key down and just give it a little blast. You could smooth that border down there so it's not so bulky. And I usually don't have my patients wear these for long at all. In fact, sometimes it's 24-hour type scenario, or even same visit where I'll have them wear it just for that appointment so I could capture a better mod jaw tracing. So the next steps that we're going to do in the freeform merge tab is go to our add and go all the way down at the bottom to file. And you're going to find this file that I'm going to load for you guys. It is a prefabricated, exactly 3mm wide platform with a distal slope to it so that it's nice for the patient's tongue. And again, I'm not going to get into the details of, if it's 3.2 millimeters, it's going to be malpractice and all this kind of stuff. It really honestly does not matter at all, as we discussed previously, but the point is to make this very easy. So rather than creating these using the parametric extrude tools and all that stuff, I think it's best just to load a prefabricated file every time. It takes 3 seconds. And once you attach it, you're going to hit allow changes and you're going to hit apply. And then you're going to go to your free form tab and you're going to go to your smooth tool, smooth flatten, hold that shift button down, bring your brush size up and just smooth any sharp edges that the tongue would really be annoyed by. I kind of smooth that ramp out a little bit, and you could smooth the seams there. And that is essentially really it. Just don't smooth too much. You wind up distorting the platform quite a bit if you go ahead and go bananas with the smooth tool. But that's it. Now, again, we could talk about all different types of, it should be 2 millimeters thick and 1.5 is going to be malpractice. The ramp, if it's 3.1 millimeters thick, you're going to destroy everything. None of that really matters, guys. It all depends on the printer and the material that you're printing with and the strength of the material. I actually really like to print these out of a tooth material, like Onyx Tough. I think that's the perfect material for this. You could also use night guard firm or key splint firm or hard. Again, this is the design. Again, you want no other contacts anywhere, not only between the posterior teeth and the appliance, but also anywhere between the natural teeth and the appliance. Super simple to do. I hope this helps you guys out, and really do appreciate the comments, and definitely open to discussion on these, guys.